New this year, the Kansas City Medical Society would like to present an Exemplary Leadership Award to Doctors Dick Warner and Art Snow for over 20 years of service and leadership at the Kansas Medical Society and the American Medical Association.
I'm Dick Warner, and I am an AMA delegate from the Kansas Medical Society, and I'm a member of the Kansas City Medical Society, carryover from the old Johnson Wyandotte County Society, of which I've been a board member and a past president. Well, there have been many things that are memorable to me. I will share one in particular. I had become a member of the Kansas delegation to the AMA, and as I spent some time there, kind of came to know who people were, and one in particular interested me was a gentleman named Ed Annis. I don't know that people much remember now who Ed Annis was, but he was the president of the AMA in 1962, and he was the most effective spokesman for the AMA in opposing what eventually became the Medicare legislation. And his great concern was that this legislation would lead to a government bureaucracy being interposed between the patient and the doctor, and led the fight to keep from passing that legislation. Well, and this is not just doctors. I think all of society benefits from what are called associate societies, associate groups. Without that sort of thing, then you're left with an individual and a government, and that's not exactly a fair proposition. I have made a number of close acquaintances and good friendships over the years, and I'm always glad to go to a meeting and see the people and hear what's going on. This is how I kind of know what's going on in the world of medicine, is by what I can pick up at the various meetings that I attend.
I chose to dedicate a lot of my professional time to playing various leadership positions in the American Medical Association and the Kansas Medical Society, because I think that's part of the profession. I think this is something physicians are obligated to do as part of their professional responsibility to provide care to patients, and that means working with professional organizations in order to improve medical care for patients, for the community. In order to provide the care for our patient, there's so many things external that interact with our relationship with patients when we see them in the office. And it's our duty and obligation, as I've mentioned before, I think professionally, to do everything we can to improve the care we can deliver patients. And that means getting out in the world, operating through your organization where you have strength in order to help with the political forces that are playing such an important role in our world today. Well, my favorite part of being involved in medical organizations, I think, is the camaraderie that comes from meeting with other physicians, being with them, having a similar goal in the medical societies.